Today, our video is regarding Buscopan, which helps to relieve pain and discomfort associated with different conditions. In this video we will discuss how Buscopan works, conditions in which it should be used, its dose, how to use, when not to use, and its possible side effects. Buscopan contains hyoscine, which works by relaxing the smooth muscles in the digestive system, bladder, and uterus, thus helping to relieve pain and discomfort. Buscopan is used for below-mentioned condition including period pain, for stomach pain and cramps, for treating irritable bowel syndrome, which is a common disorder that affects the stomach and intestines, kidney pain, including kidney stone pain, for painful spasms caused by gallbladder obstruction. Now let's see how to use Buscopan tablets. The dose shown below is for adults and children, aged 12 and above. For symptoms of IBS, the recommended dose is 1 tablet, 3 times a day. For all other pain, including stomach pain, period pain, kidney pain, or stomach cramps, the dose is 2 tablets, taken 4 times a day. For children aged 6 to 11 years, the usual dose is 1 tablet, taken 3 times a day. The medicine works very quickly. Painful cramps should ease within 15 minutes. Buscopan can be taken with or without food. If you no longer have any stomach pain or any other pain, discontinue the medicine. Buscopan is not suitable for some condition including myasthenia gravis, overactive thyroid, severe constipation, or ulcerative colitis. Some of the side effects which you may experience are dry mouth, redness of the skin, fast heart rate, difficulty passing urine, constipation. Also note that, do not drink alcohol after taking Buscopan. Do not take Buscopan with motion sickness or vomiting medicines, such as domperidone and metoclopramide, as both work opposite each other. If you have any question or suggestion, just drop below, we will answer that.